CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain clinics and doctors, chiropractors, and physical therapy practices. Today, the topic of discussion is the fungal meningitis outbreak in the United States. I just wanted to give an overview, but before I do that, let me just iterate that none of the clinics in the Florida Pain Network have been affected by this outbreak. So if you go on our website and you're looking for a pain clinic to go see, none of those have had any patients affected with fungal meningitis. So rest assured there. Well, what exactly has happened with this fungal meningitis outbreak? Well, epidural steroid injections are one of the most commonly performed procedures in the United States for pain management. And they've been done since the 1960s. They have a very low risk profile. The incidence of infection is well under 1%. The medication that is usually used for epidural steroid injections is methylprednisolone or another corticosteroid medication. Methylprednisolone is probably the #1 medication. Now, most of the time, epidural steroid or steroid medications are made by a major manufacturer, such as Pfizer, okay? Now, those are regulated by the Food and Drug Administration, and the FDA has very specific and onerous manufacturing guidelines and restrictions and regulations. So that's one of the main reasons that you usually don't see these kinds of contamination issues. In this case, the FDA has tracked the source of the infection most likely back to a compounding pharmacy in New England. And those are usually not regulated as much by the FDA as they are by the state pharmacy boards, who don't have the strict and stringent rules and regulations like the FDA does. What is a compounding pharmacy? A compounding pharmacy does not manufacture medications on such a large volume that like Pfizer does, okay? In this case, there were 76 clinics around the United States who were ordering preservative-free methylprednisolone from this New England compounding pharmacy. Preservatives are not necessarily bad to be in steroid that's used in epidural injections, but there have been some theories that they may not be so great, okay? So some pain docs on the safe side like to use preservative-free methylprednisolone, and they order from the New England compounding pharmacy. 76 clinics in multiple states. So right now you have 170 some cases of fungal meningitis, and you have at least 14 deaths in 12 states so far, okay? Because what they found was that in 2 lots of this methylprednisolone medication that came out of this New England pharmacy, that the fungus was present in at least 1 vial that they tested. So they've recalled those 2 lots. Now, a state like Nevada, for instance, got a bunch of the medication but never actually used it. It got recalled before it ever got used. Thank God, right? So Arizona had no affected cases at all. Florida has a few, and then there's a few in Idaho. There's a lot in Indiana, and then there's a lot in Tennessee, and other states like Michigan, New Jersey have a few, okay? So if you had a epidural steroid injection, for instance, at the National Pain Institute in Florida, they've been unaffected. They didn't order from this company, okay? And you can look on the FDA website and see where the clinics are that ordered from this pharmacy. Now, methylprednisolone is not just used for epidural injections. It's also used in the knee, in the elbow, the shoulder. So you may have gotten a contaminated steroid injection if you had one of those from one of these clinics, but it's not typically going to cause fungal meningitis. It might cause a localized infection, but not the fatal meningitis like we've been seeing from time to time in the last few weeks, okay? But it's the epidural injections where the contaminated medication can end up around the spinal cord and then get in the spinal cord fluid and go up to the brain and cause the meningitis. Is there treatment for that? Absolutely. The incubation period is between 1 and 4 weeks. That's why patients are being instructed to be vigilant about signs or symptoms of meningitis. And there are antifungal medications available. So if you start having symptoms and you've had an injection from one of these clinics, obviously be hypervigilant about that. But be rest assured that if you've had an injection from one of the clinics listed on the Florida Pain Network website, there's been no cases. They didn't order from this company, so there's been no fungal meningitis issues. At any rate, if you need pain management in Florida, let us help you. Go to floridapainnetwork.com, click on I Need a Pain Doctor, just put in your zip code. It'll show you the ones closest to you, or call us toll free at 877-877-8556. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.